Is this here? What qualifications do you need to work here?
For the nurses?
And doctors.
Okay, well the doctors have to be doctors, and the nurses have to be an RN.
Okay.
We can't take RPNs because we work under a lot of medical directives that only RNs can do.
Okay. Is there other medical staff except RNs and doctors?
Yep, we have a psychiatrist that comes in once a week, and we also have a dietitian, and she comes in once a week.
What other kind of staff do you employ here?
We have receptionists, 3 of those, and I think that's it. Just doctors, nurses, receptionists.
Okay. Do you guys allow volunteers to work with your patients?
Just given the limited space that we have here, we don't normally as a rule.
Okay.
Sometimes we have had nursing students do their placements here, but that hasn't happened for a few years.
Okay. Actually, that's a good idea. How large is your staff here?
We have 5 doctors, 7 nurses, some full-time, 3 full-time and the rest are part-time, and then 3 receptionists.
Okay. Yeah. What kind of skills do you gain from working here?
Good question. We mostly see healthy young adults. So we do a lot of immunizations, a lot of sexually transmitted infection testing, normal physicals, that kind of stuff. So mostly young adult sort of things. Yeah.
Do you find working with college students specifically gives you a lot more odder cases than in other work?
I don't think so. It's sort of the same as the rest of the population, I think. It's just, it's unique working with college students in that a lot of them are the first time away from home, and there's a lot of things they haven't run into on their own and that sort of thing. So we do a little bit of mothering here too.
Okay. Could you briefly describe your job description here?
We triage for the doctors. Like if somebody comes in and doesn't have an appointment, then we would see them first, and we would do the assessments and see if they needed to be treated immediately or whether it can wait until they can get a doctor's appointment. We do certain things under the medical directives. We do vaccines, blood tests, ordering chest x-rays, that sort of thing for people that have positive TB tests, and we get all of the students that have a placement in the community, we get them ready to do their placements, so make sure all their immunizations are up to date and their titers are drawn and that sort of thing.
Okay. And would a doctor here work as would their job description be like a clinical doctor anywhere else?
Yep, same as a normal family doctor.
Okay.
Yeah.
Do you employ new nursing students at all?
No. Well, we have one right now that's working for us just sort of casual. She was our summer student for the last 2 years.
Okay.
And she's just finished up her BSCN program. She just finished her 4th year.
Okay.
So we're going to lose her.
Oh. Would you guys employ RPN nursing students for the summer?
It's possible because they don't really do nursing tasks.
Okay.
The summer student that we get mostly does front-end stuff, but it's nice to get a nursing student because they're familiar with it and they don't freak out at the sign of blood and that kind of stuff. So yeah, we usually try to get either a paramedic student or a nursing student.
Okay. What are you funded by? Like, who funds the clinic?
It's mostly college money that's put in. The Students Association also gives us a portion of funds from the healthcare portion of the Students Association fees. And then the doctors that work here pay a percentage of their billings to maintain the clinic as overhead.
What does the average day consist of for you guys?
There is no average day. It could be, sometimes we get in at 8:30 in the morning and there's people lined up out the door, and then it would depend, like this year we had H1N1 to deal with, so that was not a normal kind of thing.
Yeah.
So yeah, it could be anything. I mean, we've had people going into labor, we've had people having heart attacks, it just depends on what the day brings, but it's different every day.
Sounds exciting.
Yeah.
What kind of birth control do you guys provide the students?
We have a pretty complete range of the most popular birth control methods right now, and we sell them at a reduced cost to the students. So we have birth control pills, NuvaRing, Evra. We don't do Depo too much anymore,
Okay.
but yeah, pretty much anything that they're prescribed they can get here.
Which one would you consider the most popular out of all of them?
What brand or what type?
What type?
I think right now it's sort of evenly split between the NuvaRing and birth control pills.
Okay. Could you describe what the NuvaRing is?
NuvaRing is it's a round, looks like this.
Okay.
It's a round circle, and it's impregnated with estrogen and progesterone, and it's time released. So a woman puts it in the vagina. It stays there for 3 weeks, and then you take it out, and they get a period. And then
What kind of birth control do you find the most popular out of all the brands?
of the brands, out of the pills, probably. That's a good question. Probably tied between Elessa and tricycline low.
Okay. Do you think it's like, is it kind of like that's the most popular brand because that's the best kind, or is this just?
I think it's they've done pretty good advertising. I don't know. So people come in and ask for it by name, and if they've never been on the pill before, then doctors will just give them what they want, try it out for a few months, and if it works for them, then they write them a longer prescription. But sometimes people have to juggle which ones they're taking. They have to try out different ones to see what works for them.
So some birth control pills would work better than others?
Not for preventing pregnancy, but some women have better mood, that sort of thing, when they're on different levels of hormones, so they try different ones. Some of them make people kind of teary and give some headaches and moody, so they usually try and go to a lower dose pill then to kind of get that out.
Would some birth controls make people nausea?
They can. They can. It just depends. So some people, if that does happen, we usually recommend that they take it at night before they go to bed.
Okay. Right, and that's about it.
Okay.